Good morning, everybody. It is 11 minutes past 7 o'clock right now. Welcome back to Iowa Live. Lou and Jackie here.
Good
Being
morning.
joined in the studio by Dr. Devon Goetz. He is a doctor over at DMOS. And this morning, Jackie, we are going to be talking about a partially assisted robotic surgery when it comes to getting your knee fixed.
Yeah, welcome to your Orthopedic Minute here on Iowa Live. Thank you so much for joining us here today.
You're welcome.
So let's break it down. What does that mean when you are using robotics to assist you in surgery?
So robotic assisted surgery is where the surgeon has a robot to help him do the surgery more precisely as opposed to doing something manually. We still make the incision, we still expose the joint in this case, but the robot helps us make sure that we get the implants exactly where we want them to be.
Okay, so let's just clarify. This is not saying a robot's going to do your surgery. A robot is just
Correct.
doing the precision work that you're controlling the robot too, though, aren't you?
Correct, correct. It's actually more work for us to do it with the robot than without, because there's a lot more preoperative planning with the robot than there is without it.
All right.
And I was going to ask how large it is, and you can kind of see there with this visual that's on the TV. That's a pretty decent size object to be working with.
Yeah, it's very large. That arm would be maybe the size of a football player's arm as opposed to mine.
Oh, really? Okay.
Yeah.
Now, so how do you control this thing? Is it like a joystick, or how do you do this? How do you manipulate?
Yeah, so you bring it into the position, and then the assistant that's running the robot for you tells it that it's armed or ready. And then once it's ready, you use this burr to remove the bone, but it won't let you draw outside the lines. So it's like painting in a coloring book, and it will not let you.
So do you have like a tablet or something, or some kind of screen that you use to put pressure on where the robot goes? Or
Yes, so prior to the surgery, in this case we're talking about partial knee replacement.
Partial
so
knee.
we use the robot to do partial knee replacement. And just to clarify, partial knee replacement as opposed to total knee replacement. In a total knee replacement, we're putting a new surface over the entire surface of the knee joint, the front or the kneecap part, the medial side or inner side, and then the lateral side or outer side.
that's the whole thing.
That's the whole thing. And in
Okay.
a total knee replacement, you would get a surface on all of those parts.
Okay.
But in a partial, we do either the kneecap part, which is called patellofemoral, or the more common one is the medial part right here. So this right here is an example of a medial partial knee replacement. And so what the robot does, before we do the surgery, we get a CT scan of the knee. The CT scan then creates a map or a 3D model of the knee, and then we tell that model where we want the implants to be. The computer gives you a suggestion, and then we tweak it based on that patient's individual needs or preferences. And then during the surgery, the robot will not let you go outside of what you told it to do.
Okay, so what is the robot doing exactly? Is it removing bone, or what is it doing?
Yes,
Okay.
yeah. So after we've made the incision, we've exposed it. It's removing the bone that allows this thing to be where it is here, you see.
Okay.
So it's made these 3 holes, it's removed this. And usually
So it's basically removing this chunk of the knee?
It's removing the bone there that I just dropped on the floor.
Okay. Okay, so it's gone anyway. We don't need it.
Yeah,
anyway. Okay.
and then you put, at the end, you put that implant there.
So that would be the implant that would go in there.
So that's
okay.
for a kneecap part. The more common robotic procedures where we do this part right here.
Okay.
Okay, so usually you do one or the other, not
So
both.
it has to be offset a little bit to compensate for the implant that is going in there. You can't just take it and lay it on top of the bone.
Correct, correct. You need to make a depression.
To give it room.
Right, right, because you don't want it to stick out.
Like the countersink it is what you're doing.
Correct, you're countersinking it.
All right.
And so you want it to be flush with the bone so that it feels exactly like a normal joint and runs as smoothly as a normal joint.
And how did you guys have to do this before the robot came into play and you were able to get so precise with it?
And we still do it that way sometimes too, but for partial knee replacement, it's just harder to get the implants in perfect position than it is, say, for a total knee replacement or a total hip replacement. So even though you can do those procedures with a robot too, we find those, the robot hasn't taken us to the next level yet. Someday it will. But in partial knee replacement, it's so difficult to get those implants in perfect position.
Because they have to be just right, don't they?
Yeah. So before the robot, we would use a saw to cut those defects or burr away those areas for the bone. on our own, you know, based on our eye.
So is this becoming more standard practice because it is so much more
It
precise?
is, yeah. I'd say, you know, it's maybe 10 or 15% of procedures, at least at DMOS.
And how long did it take you to get proficient with the use of this robot?
Probably 2 or 3 practice times on sawbones, you know, on fake bones, and then probably took me 2 or 3 procedures on humans before I felt I was really good at it.
What does it feel like when you're doing that, when you're using the robot, you know, because you're using like a tool now, and you're not actually taking the tool and placing it on the bone, the robot is actually doing...
It feels very strange. You feel like, sometimes you're like, please, yeah, you know, it's taking you somewhere and you're not sure that it's doing the right thing.
But
you know,
you are there, and you are hands-on, so this
you're
isn't
holding
just,
on to it.
This isn't just punching buttons into a machine and say, okay, do the work.
Correct.
You are manipulating the arm of the robot yourself, so you are driving this thing.
Exactly. So you're holding on to the burr while it's doing that. And for example, if my assistant were to not be holding the soft tissues out of the way appropriately, I would stop. I would make the robot stop.
Okay.
So that they could then get some soft tissues out of the way that I don't want to injure.
That is fascinating.
Yeah.
But on the other hand, it almost sounds like it has a GPS system, so it knows exactly where to go, and that goes back to that precision part.
Yep, it does. It knows exactly where the femur is, exactly where the tibia is, and then the robot then knows where the groove has to be.
That is amazing.
It is amazing what's happening
it's phenomenal.
in the medical world. Okay, so if people want to learn more about this, maybe realizing that this is an option for them, because we understand joints, they get injured out there.
Right.
How can they get more details?
Well, they can go on the DMOS website, or they can go on Stryker. This is called a Mako, M-A-K-O, and then go to Stryker and look up Mako for this particular robot.
DMOS.com is probably the best place to go,
yes.
right?
Yeah.
Perfect.
Yeah.
Yeah, excellent. Now, what office are you in?
I'm in the West office at
All right,
6001.
right down the street here, right?
Yeah.
Okay, so we can stop by and visit you.
That's right.
All right, perfect. Thank you so
Thanks
much for
a lot.
coming in.
Nice
Great
to
to
meet
meet
you.
you,
Thank
and
you very much.
amazing things going on. And again, we're talking partial knee replacement and a robot assistant. How neat is that? How cool is that? And they have that available right down the street at DMOS. Good morning. We'll be right back.